Welcome back to this YouTube channel. Welcome back to Nursing channel. So in today's video, we are going to talk about blood pressure. Blood pressure, blood pressure. Do you know the meaning of blood pressure? If somebody say, I have a blood pressure, or if the doctor tells you that you have a blood pressure, will you understand what the doctor is talking about? And how do you know that you have a blood pressure? And in case you have a blood pressure, what are you supposed to do? And how do you know that you are at risk of getting blood pressure, or who is at risk of getting blood pressure? Let's get into the video. Good morning, everyone. If you're new here and you have not subscribed, kindly please subscribe. Returning subscriber, I always appreciate. Make sure you watch this video up to the end. So let's look at the overview of blood pressure. Blood pressure is the measurement of the pressure of the force of blood inside your arteries. Yeah. Each time your heart beats, it's pump blood into the artery that that carry blood throughout the body. Yeah, this happens 60 to 100 times a minute in 24 hours a day. So arteries deliver oxygen and nutrients in your whole body so it can function normally, or so that you can have normal function of the body. I think I'm right, and I think you have known what now we are about to talk about. So let's talk about blood pressure versus heart rate. Yeah, so both of these have to do with heart, but they are two different things. Blood pressure is how powerful your blood travel through your blood vessel, and heart rate is the number of times your heart beats in 1 minute. Yeah, so an increase in heart rate doesn't mean you have a blood pressure, or doesn't mean your blood pressure is going up. The only way to know your blood pressure is to measure with blood pressure machine. Yeah, maybe you are asking yourself, why do blood pressure fluctuate? Why do small children or young children have a higher blood pressure or lower blood pressure than middle age? And why do adults also suffer from blood pressure than younger people? So your blood pressure doesn't stay the same at all time. You have to know that your blood pressure doesn't stay the same at all times. It changes based on what you are doing. When you are exercising or excited, your blood pressure may change or may go up. When you are resting, your blood pressure may become low. So your blood pressure can also change because of your age, medication you are taking, changes in position, among any other activities maybe you are performing during the day or the whole of your lifetime. So why am I even talking about blood pressure? Because most of the people right now, a lot of people suffer from blood pressure. And why blood pressure matters? So high blood pressure, it's called a silent killer. High blood pressure is called a silent killer. Usually it has no symptoms. It can damage your heart slowly, it can damage your kidneys slowly, and it can damage your brain slowly. Before you know it, everything is wrong and you might go. You might die. So high blood pressure is a major risk factor for cardiovascular diseases. Without treatment, high blood pressure can cause so many complications and can cause so many health issues. So these are the complications or health issues that high blood pressure can cause. Number one, blood pressure can cause stroke. Blood pressure can cause heart attack. Blood pressure can cause enlargement of the heart. Blood pressure can cause heart failure. Blood pressure can cause peripheral artery diseases. Blood pressure can cause aneurysm, and blood pressure can cause kidney diseases, and also it can damage your blood vessel. So blood pressure can cause a lot of health problems apart from even what I have stated. So it's always good that you go check your blood pressure using blood pressure machine, and you ask the person taking the vitals, the specific vitals, that blood pressure, if it is normal or if it is not normal, so that you do something before it causes damage to your body. Another question that you are asking yourself, I know you are asking yourself and maybe you don't have an answer. Now, who is at risk of getting high blood pressure? Who is at risk of getting high blood pressure? I said blood pressure changes with so many stuff. Maybe if you are resting, maybe if you have an exercise, maybe if you are taking medications. But we have a certain question that we must answer, and this is, who is at risk of getting blood pressure? Number one, if you have a family history of blood pressure, if somebody close to you has ever suffered from high blood pressure, just know that you are at risk of getting high blood pressure, or you are at risk of getting hypertension. Number two, if you are black, they say that black people are at risk of getting high blood pressure, but I don't know the reason why. Because if you check, if you just do your own research, those people who are obese are the whites. The people who are obese are the whites. And remember, obesity is one of the risk factor of hypertension or high blood pressure. So I don't know the reason why the researchers found that black people are at risk of getting blood pressure. Number three, old age, above 60 years. If you are 60 years and above, you are at risk of getting blood pressure. This is because maybe your heart is getting tired, and maybe also because the system is tiring, and now the heart is struggling to pump blood. You might get blood pressure when you are 60 years and above. It's not everybody, but you are at risk. The next point, if you have high cholesterol in the blood, you are at risk of getting also high blood pressure. Another thing, if you're using all these birth control pills, especially if you're using hormonal contraceptives, you are at risk of getting high blood pressure. If you have not watched my series of family planning, kindly go and watch, so that you know the reason why someone who is using hormonal contraceptive can suffer from high blood pressure or hypertension. Another thing I said also when I was starting this specific subtopic about who is at risk of getting blood pressure, I said obesity is one of the most cause or risk factor of blood pressure. Another one is also when you are suffering from diabetes, you are at risk of also at the same time suffering from high blood pressure. Most of patient, if you diagnose a patient with blood pressure, this patient you should also monitor for sugars, because they are always at risk of getting high blood pressure, vice versa. If you are managing a patient of who is a diabetic patient, if you are managing diabetic patient, or if you have a patient who is having diabetes mellitus, monitor this patient for blood pressure, because they are at risk of getting blood pressure, because high sugar in the blood usually damage the blood vessels, and if blood vessels have been damaged, just know that you are at risk of getting high blood pressure, or automatically you will suffer from blood pressure. So if you have a patient, if you are a healthcare provider and you are dealing with hypertensive patient and diabetic patient, check for usually monitor for blood sugar and blood pressure at the same time, so that you know what to do next, or you don't wait a patient to complicate. Is when you start doing something. Another person or another group of people who are at risk of getting high blood pressure is those people who are using tobacco or cigarette smokers, tobacco users. These are also a group of people who are at risk of getting high blood pressure. Another group of people, before the distraction is those who don't do exercise. They are also at risk of getting high blood pressure. And the last group of people are those who are using high salt diet, or those who eat high salt in the diet. They are at risk of getting high blood pressure or hypertension. So when is blood pressure checked? Blood pressure should be checked regularly. You should always be checking your blood pressure, so that you know if you are about even to suffer from high blood pressure, or if you are already suffering from blood pressure. So that, because I said it is a silent killer, if you are having high blood pressure and it has not been managed, you will it will damage the kidney, it will damage the brain, it will damage the heart, it will damage the lungs, and you will just die silently. So be checking your blood pressure regularly, because it is very important, and because we can prevent the complications that might set in, like the one I said: stroke, heart attack, heart failure, those artery diseases, among other things that I already talked about. So another also very important question is that, is high blood pressure or hypertension treatable? The answer is no. If you have been diagnosed with high blood pressure or hypertension, the only thing that we can do as healthcare provider is to regulate or to prevent the complications. So you will live under medication to help your heart pump within a normal range, so that you don't you don't suffer from complications, or high blood pressure cannot will not damage the blood vessels. In short, I'm saying, if you've been diagnosed with high blood pressure, you will live under medication to prevent all these complications that might cause death. Apart from medications that you will get during or when you have this condition, you will also practice healthy diet. You will avoid salt in your diet. You will avoid eating high cholesterol. You will do exercise, or you will start regulating your weight. And also you will make sure that you eat well-balanced diet, and as you take your medication, so that you don't develop complications. So the last thing that I want to say about high blood pressure, it is preventable. Like I said, we have some risk factors, or people who are at risk of getting blood pressure. Number one, you should have you should avoid eating a lot of salt in your diet, and you will not get blood pressure. Number two, you should have a normal weight. you should not be obese. And if you are obese, start doing exercise so that you don't proceed to that level that you will have hypertension. Number 3, if you're using tobacco, kindly stop it, because it is putting your life at risk. It is damaging your blood vessels slowly by slowly. So avoid taking tobacco, or avoid using cigarettes, so that you avoid having, or you prevent yourself from getting high blood pressure. Another thing that you should also avoid using hormonal contraceptives. Avoid using hormonal contraceptive. You can use natural family planning, you can use barrier method, you can use non-hormonal, and you will not get high blood pressure. Another thing that you're supposed to do so that you prevent blood pressure from getting you, or from suffering from the condition, is regulate stress, or avoid stress at all cost. Avoid stress at all cost, so that you don't get high blood pressure, or you don't suffer from hypertension. I think maybe I have exhausted. If I've left anything behind, you can comment in the comment section. And if you want me to talk about something else, if you want me to talk about a certain condition, or if you want me to explain more about a certain condition, you can comment in that comment section. I will always consider that. The last thing that I want to say, that I will still continue with pregnancy series. I just stopped because of some reasons, but right now we are on that. We will start bringing content concerning pregnancy series. Anything related to pregnancy, we will be talking about it here. So stay tuned. If you have not subscribed, I don't know what you are waiting for. Kindly please subscribe. Make sure that you share my content, and make sure you comment what you want me to talk about. I will consider you on that. Thank you for watching this video up to the end. If you have not subscribed, kindly do so. And returning subscribers, those who always watch my content, thank you very much. I appreciate that. Let's meet in the next video. Bye till next time.